Hello, I'm Dr. Jon Ark, Chair of Orthopaedics at Princeton Medical Center. I am board certified in orthopedic surgery and hand surgery. Today, Sangita Verma, a physical therapist and director of Princeton Rehabilitation, and I are going to review two common hand and wrist problems, the signs and symptoms, and how they're typically treated. Using your hands is something you do thousands of times every day, usually without giving it a second thought, whether you're grabbing that first cup of coffee in the morning, typing on a computer keyboard, or using a tool at work. And because your hands are always busy, they're very susceptible to repetitive motion injuries. Two of the most common injuries are carpal tunnel syndrome and trigger fingers. Both conditions can strike anyone, particularly today, since so much time is spent using smartphones, tablets, and computers starting at a young age. And they can make everyday activities painful and challenging. People with repetitive motion injuries may experience unexplained pain, numbness, swelling, or mobility problems. For carpal tunnel syndrome, symptoms can include tingling or numbness in the fingers or hand, weakness in the hand, and a tendency to drop objects. Patients also experience sensations that feel like an electrical shock in the fingers. Those patients with trigger fingers have symptoms such as finger stiffness, particularly in the morning, popping or clicking sensations during movement, or occasionally finger catching or locking in a bent position. Patients often feel some tenderness or a bump in the palm at the base of their finger. If you're experiencing symptoms of carpal tunnel syndrome or trigger fingers, the first step is to visit a physician for a diagnosis. The physician will perform a physical exam and possibly order an x-ray to rule out arthritis or other diagnoses. If carpal tunnel syndrome is suspected, your doctor might order an electromyogram or nerve conduction study to better evaluate your injury. During this test, a thin needle electrode is inserted into specific muscles or along the course of nerves to assess electrical activity of the nerves. The test can identify muscle damage and may also rule out other conditions. It's important to remember that the sooner the condition is identified, the faster you can start treatment. And early intervention often leads to better outcomes than delayed treatment. Physical therapy is often part of the initial treatment and recommended after surgery to help speed recovery and improve outcomes. Sangita will describe the role physical therapy plays in the treatment of repetitive motion conditions.
If you have a repetitive motion injury, you will likely start with conservative treatment. If you have carpal tunnel syndrome, you may be prescribed anti-inflammatory medication and be fitted for a splint that will keep your wrist in a neutral position and help control symptoms. In some cases, learning workstation modification techniques through physical therapy can help as well. For example, you may need to make adjustments to the height of your work or desk area so you sit with proper posture and with your wrists in a neutral position. It may also be beneficial to increase the diameter of the work tools to decrease grip forces. If vibration is a factor at your workplace, we often recommend the use of anti-vibration gloves. Also, varying or rotating tasks and avoiding forceful or repetitive activities is important. Finally, depending on your condition, a physical therapist will recommend specific exercises and stretching techniques that increase strength and flexibility of the muscles in your hand, wrist, and fingers. Nerve gliding exercises that help the nerve glide smoothly through the carpal tunnel may also be recommended. For trigger fingers, warm water soaks, anti-inflammatory medication, and rest will likely be recommended to decrease pain. You may also be fitted with a splint and taught tendon excursion exercises that you can do at home to relieve pain and improve the condition. Many patients see improvement within 2 to 3 weeks. If symptoms are severe, improvement may take up to 4 to 6 weeks. Our goal is to help patients who will benefit from physical therapy work within the restrictions of their condition and improve strength and flexibility to maximize function so they can carry out their daily activities.
If physical therapy treatments don't resolve the problem, then we generally try treating with cortisone shots. For some people, a single shot will provide the relief they need. For others, it may not. We can offer cortisone injections up to 3 times, and if the patient still doesn't have symptom relief, we will discuss surgical options. There are now minimally invasive surgical options available to treat these conditions. These procedures, as well as most traditional surgeries, are performed on an outpatient basis. If you're experiencing the symptoms we reviewed today, contact your primary care physician or an orthopedist who can diagnose your condition and discuss treatment options. Whichever solution is best for you, we know that you want to return to your everyday activities and perform them without discomfort as soon as possible.